Good day, everyone. I'm Dr. Nemencio Nicodemus Jr., and today we will discuss COVID-19 in people with diabetes. I have divided my talk into 4 parts. Let us begin by talking about an overview of COVID-19. Let us try to understand what causes this particular disease that has affected the entire world. COVID-19 is caused by a type of human coronavirus. Human coronaviruses are called as such because if you look at their structure, they have a single RNA that is enveloped by a membrane with several proteins jutting out, forming a crown structure. And these particular proteins are exemplified by the spike protein or the S protein, which will be very important in the pathogenesis of this disease, as we will be seeing later on. How did these human coronaviruses start infecting humans? These coronaviruses were just infecting animals at the start. In fact, the key reservoir of the human coronaviruses were just bats and even rodents at the start. But there were interspecies transmission within these animals, and the only time that there was human transmission was when humans start consuming some of these animals for food. And of the different types of coronaviruses, the alpha and the beta coronaviruses are the ones that can transmit disease in humans. Let us focus our attention on the SARS-CoV-2, which is the virus that causes COVID-19. The SARS-CoV-2 was initially found primarily in bats as its host. However, humans became infected with the SARS-CoV-2 when humans started consuming bats as part of delicacies. And the only time that the humans now became the intermediate host was after this. In the last couple of weeks, we saw the human-to-human transmission as we see all over the world. The SARS-CoV-2 enters the human body initially through droplet infection. And you can see here that the virus, which has the S protein as part of its membrane, will only enter the cell if there is a particular receptor. That receptor has been identified in humans as the ACE2 or the angiotensin converting enzyme 2. With the aid of the ACE2, the SARS-CoV-2 virus enters the human cells, and once inside the human cells, the RNA can now be replicated, and within the human host, this particular virus replicates itself, such that using the human genetic material, you now produce more and more viral particles which are shed off and can now be a source of infection for other human beings. Let us understand the ACE2 or the angiotensin converting enzyme 2, which is a very important protein found in humans. ACE2 is a surface receptor that is expressed by epithelial cells of the lungs, the intestines, the kidneys, and blood vessels in humans. It is homologous to the angiotensin converting enzyme and provides homeostatic regulation of the circulating angiotensin 2. What does it do? The ACE2 converts your angiotensin 2 to angiotensin 1 to 7. And it is this very important protein that is found in human cells that attaches to the S protein of the coronavirus of the SARS-CoV-2. But a human will not be easily affected or even infected by viruses if there aren't any factors that increase the pathogenesis of this particular disease. There are viral factors that influence the pathogenesis of SARS-CoV-2, and first and foremost of this is the presence of the S protein. As we have mentioned, it is the S protein that attaches to the host via the receptor, which is the ACE2. Aside from this, however, there are other proteins that are involved in influencing the pathogenesis of SARS-CoV-2 in humans, but they are of less importance as of now. What happens to a human being once the SARS-CoV-2 enters the system and infects a human? It manifests itself with several symptoms. And based on a systematic review and meta-analysis of populations affected by the SARS-CoV-2, fever is the most common presentation of this particular disease, followed by cough and dyspnea. Thus, it is mostly the pulmonary symptoms which alerts an individual to the presence of this infection and which is seen mostly in the clinical practice of several nations all over the world. Aside from the virus, however, there are important factors found in humans that influence the pathogenesis of SARS-CoV-2. And first and foremost of this is the presence of the receptor, the ACE2, which now allows the entry of the SARS-CoV-2 virus inside human cells. We also know that there are certain individuals who are more susceptible to this disease, particularly the elderly, more than 65 years old, and those with underlying diseases. Some of the underlying diseases that have been identified as increasing the susceptibility to the SARS-CoV-2 virus include hypertension, chronic obstructive pulmonary disease, diabetes, and cardiovascular disease. What happens to individuals if they have these underlying conditions that make them more susceptible to disease? They manifest with more severe manifestations, and in fact, they are at higher risks of developing complications due to COVID-19. In a systematic review of the complications related to COVID-19, it was shown that acute respiratory distress syndrome is the most common complication of COVID-19, and in fact, is one of the leading causes of mortality among people affected by this particular disease. Now we go to the second part. We now look at the effect of diabetes on SARS-CoV-2 infection. If we go by the number of underlying diseases and comorbidities that are found among different populations with COVID-19, a meta-analysis in the United States was able to show that aside from hypertension and cardiovascular disease, diabetes ranks top 3 among the underlying conditions that are found among hospitalized patients with COVID-19. Thus, we can say that 1 in every 12 COVID-19 patients in the United States has diabetes. But in another meta-analysis that was conducted among the Chinese population, the prevalence of diabetes among those affected with COVID-19 is 10%. Thus, 1 in 10 SARS-CoV-2 infected patients in China have diabetes. What could be the reason why diabetic patients are easily affected by COVID-19? Let us look at the potential mechanisms that increase the susceptibility of this very important population of patients. Several hypotheses have already been put forth, and these include the higher affinity cellular binding and the efficient virus entry into the host of a diabetic patient, decreased viral clearance, diminished T-cell function, increased susceptibility to hyperinflammation and cytokine storm syndrome, and the presence of cardiovascular disease. We all know that all of these factors are present among our patients with diabetes. If we will put that into an illustration, this is how it will look. As the SARS-CoV-2 virus enters the human being, there is now an infection of the respiratory epithelium. But among patients with diabetes, what has been found in studies is that there is an increased expression of the ACE2 receptor There is, as we all know, an impairment in the macrophage activity, particularly among patients who have elevated blood sugars, and they also have impaired neutrophil recruitment. And because of this, the immune system of a patient with diabetes is dysfunctional. And this causes now dysregulated immune responses leading to a cytokine storm. This, together with the necrosis of the respiratory epithelium, causes now severe pneumonia and leads to acute respiratory distress syndrome and even systemic inflammation and multi-organ dysfunction among people with diabetes. But is ACE2 really something that we should be worried about? Is it just active now that we have the COVID-2? In reality, among patients with diabetes, the ACE2 is overexpressed. And this role of ACE2 amplification among patients with diabetes is something that has already been known even years before we had the COVID-19. The ACE2, as we said, converts angiotensin 2 to angiotensin 1 to 7. Does this have any beneficial effect in the body, particularly of those with diabetes? Yes, in fact, if you have more of the angiotensin 1 to 7, as far as the pancreatic islets are concerned, you have a reduction in the apoptosis and an increase in the islet cell proliferation. Thus, it helps a person with diabetes. And as far as the kidneys are concerned, if you have more of the angiotensin 1 to 7, there is a reduction in the reactive oxygen species, reduction in inflammation, and this also has a beneficial effect on the kidneys of a person with diabetes. And so angiotensin 2 has its role in people with diabetes, and its overexpression serves as a beneficial mechanism in people with type 2 diabetes. Thus, the overexpression of ACE2 is something that is seen among patients with type 2 diabetes. But this has implication in COVID-19 among patients with diabetes because ACE2 serves as a receptor and you now have more SARS-CoV-2 viruses that can enter the human cells. The implication is seen in this meta-analysis where they were able to show that diabetes increases the risk of severe infection among patients with SARS-CoV-2 infection, and thus diabetes can worsen the outcome of COVID-19 by having overexpression of your ACE2. Furthermore, diabetes, as was shown in another study, is associated with significantly greater risk of developing ARDS. In fact, the hazards ratio is more than 200% increased. If we are to summarize now what happens among patients with type 2 diabetes who have COVID-19, they are at higher risk of severe pneumonia because they release tissue injury-related enzymes. There is an excessive uncontrolled inflammation, and these are in the form of increasing inflammatory responses like interleukin-6, CRP, serum ferritin and D-dimer, and there is also a hypercoagulable state. Thus, patients with diabetes are more susceptible to an inflammatory storm, eventually leading to rapid deterioration of this particular disease. Does this have any implication on mortality? What we have are data coming from China. And in the earlier reports, among the Chinese population, particularly those in the Wuhan province, what they found out was diabetes was present in more than 40% of the fatalities due to COVID-19 in the Wuhan province, and that there is an increased mortality in people with diabetes compared to those without diabetes. Now let's go into the treatment of diabetes in COVID-19. It is very important that a person with diabetes is familiar with the measures that are needed to do in order to prevent and even treat this particular infection. The measures that are very important in patients with diabetes who have COVID-19 include, first and foremost, notification of healthcare authorities in case a person with diabetes develops the symptoms fever, cough, runny nose, and dyspnea. As we have said earlier, fever is the most important and the most common symptom of COVID-19. Secondly, people with COVID-19 should isolate themselves from other people in order to prevent infecting other people for about 14 days or until the symptoms resolve. Thirdly, people who have mild disease must stay at home and must hydrate themselves and may take medications in order to improve symptoms. Since these patients are diabetics, it is important that those with type 1 diabetes should measure their blood glucoses very regularly, and if needed, there should be urine ketone measurement. And it is important that since infection is present, there should be frequent changes in the dosages of medication, particularly insulin, and the correctional insulin doses must be adjusted to maintain normal glycemia. Among people with type 2 diabetes and COVID-19 infection, it is important that the anti-hyperglycemic agents that can cause volume depletion or hypoglycemia are avoided, and that the dosages of these oral anti-diabetes drugs are reduced, particularly when food intake is also reduced. And it is also important that blood glucoses are monitored more frequently in order to adjust the dosages of the drugs to treat diabetes at home. But we all know that there are patients with diabetes who get admitted to the hospital. So what should be the measures that must be taken among patients who are admitted to the hospital? These patients, particularly those with severe disease, need more frequent blood glucose monitoring, and oral agents like metformin and sodium glucose cotransporter 2 inhibitors need to be stopped because we all know that these may cause fluid shifts among hospitalized patients. Of course, very important that we choose the proper agents to control diabetes among hospitalized patients who have COVID-19. And here, insulin is the preferred agent for the control of hyperglycemia, particularly among these very sick patients, because it has been shown in animal studies that insulin reduces the expression of the ACE2, the very important receptor that allows the entry of SARS-CoV-2 viruses inside the body. There are, however, other agents based on animal studies that can increase the expression of ACE2, and these include the GLP-1 agonist, the thiazolidinediones, ACE inhibitors, and even statins. But before we even think of stopping ACE inhibitors and even statins among our patients with diabetes, let us remember that the benefits far outweigh the risk when we talk about treating our patients with ACE inhibitors and statins and COVID-19 infection. How many among our patients with diabetes actually do have good control when they are admitted? And the data that I'm going to share with you pertains to hospitalized patients with COVID-19, and these include patients who were monitored with their blood glucoses, and the study was able to show that as more than half of the patients have abnormal blood glucoses, and as you can see here, some have elevated fasting blood glucoses, but there are more who have elevated postprandial blood glucoses. In fact, you can see here that 2 out of 3 patients admitted with COVID-19 and diabetes had blood glucoses that were not ideal for the situation. And you can see that 1 in 10 patients may also present with hypoglycemia. How come we have this very sad reality of uncontrolled blood glucoses among our hospitalized COVID-19 patients with diabetes? Several potential reasons have been put forth, and these include the relative shortage of available endocrinologists that now, of course, lead to a delay or absence of professional advice. We all know that there are now several centers that have become COVID centers or even referral centers that may not have endocrinologists as part of their staff. And this poses a big problem when it comes to the management of patients with COVID-19 and diabetes. We also know that during admission, personalized diet may not be available, particularly among these COVID centers or isolation centers. Because of the situation, patients with diabetes are also unable to exercise due to limited indoor space and poor pulmonary function. Because they are dyspneic, they cannot perform the regular exercises that we asked them to do when they were well. And we also know that there is the anxiety led by COVID-19 that induces hyperglycemia also because of the increases in the catecholamine responses in the body of an infected person. And finally, it is postulated that the pancreatic tissue is also a potential target of viral infection, and therefore this leads to dysregulated glucose homeostasis in the body of a diabetic patient with COVID-19. Given all those now, how do we stratify our glucose management for our admitted type 2 diabetic patients with COVID-19? We must stratify patients into 3 categories. Those with mild and moderate diseases and who are non-elderly, and among these patients, we must enforce a strict high control target. Among our patients who have mild to moderate diseases but are elderly, or those patients who have been using steroids, the recommendation is to just do low or medium control target glucose management. And finally, for those presenting to us with severe and critical illness, particularly those elderly who are hypoglycemia intolerant or patients with multiple organ dysfunction and serious cardiovascular and cerebrovascular diseases, it is recommended to just put them on a low control target. What are these high control, medium control, and low control targets? This particular slide gives us the values that we must achieve among our patients. You can see that if you want to strictly control the blood sugar of your diabetic patients, it is recommended that their fasting plasma glucoses be between 80 to 110 milligrams per deciliter and their postprandial blood glucoses be between 110 to 140 milligram per deciliter. For those patients who have severe illnesses with serious cardiovascular and cerebrovascular diseases, you do not want to bring down their blood glucoses to very strict levels. In fact, the target is just between 140 to 180 milligram per deciliter fasting and between 180 to 250 milligram per deciliter postprandial blood glucoses. In all of these, let us remember that what we must avoid is hypoglycemia during the glucose management of our patients with COVID-19 and diabetes, and that if hypoglycemia is present, medical care should be instituted in a timely manner. In order to guide us on how to use insulin, being the most important medication for our patients with diabetes, we can see here in this slide that we can divide our patients into those with type 1 diabetes, wherein during the time that they have COVID-19, they may need to use insulin analogs as first choice of their insulin treatment, and that this should be based on their individualized insulin requirement, and individualized glucose targets. For our patients with type 2 diabetes, those with mild diseases and even the moderate diseases may still continue with their oral agents. But for patients who already have fever and even those being treated with steroids, the first line drug of choice are your insulins. Especially if they are admitted, we might need to use intravenous insulin. And for those who are being treated with steroids, it's important that we give insulin as the drug of choice. Finally, is there something that we can do to prevent SARS-CoV-2 infection among our patients with diabetes? Some of the general measures that are recommended to prevent COVID-19 among people with diabetes include thorough hand washing with soap and water, proper respiratory hygiene, minimize contact with affected individuals, and avoid non-essential travel to major affected areas. As you see, these recommendations are not very specific for people with type 2 diabetes, but are measures in general for everyone in order to prevent COVID-19. But specific measures for the prevention of COVID-19 among people with diabetes include good glycemic control in order to improve the immune system, stabilization of cardiac and renal function, proper nutrition and adequate protein intake, adequate exercise in order to improve immunity, and, if possible, vaccination with influenza and pneumococcal vaccines. Let me summarize what we have talked about using these 4 very important points. Number 1, approximately 10% of SARS-CoV-2 infected patients have diabetes. Diabetes may not increase the risk of SARS-CoV-2 infection, but indeed, they may promote the progression to severe COVID-19. Number 2, that diabetes comorbidity is associated with significantly increased mortality from COVID-19. And number 3, that diabetes with COVID-19 present with poorer glycemic control and that insulin injection should be the first-line treatment, particularly for patients with severe and critical illness. And lastly, people living with diabetes are not more likely to get COVID-19 compared to anyone else, but there are several ways to prevent SARS-CoV-2 infection, particularly among these high-risk individuals. Thank you very much. An effective way of explaining to our patients with diabetes and COVID-19 how this particular virus affects them is the fact that with infection, we all know that our body releases stress hormones, catecholamines, that further increase the blood sugar of a patient with diabetes. However, we also know that during this COVID crisis times, people also are able to change their dietary habits. And so because of the changes in the dietary habits of people and even the presence of the infection, there will be fluctuations in the glucose levels of these patients with diabetes, and therefore it is important that we adjust the dosages of their medications according to their blood glucose levels. And this highlights now the importance of more frequent blood glucose monitoring, whether at home or in the hospital, in order to titrate the dosages of medications being administered to the patient. When our patients with diabetes get infected with COVID-19, it is important that they notify health authorities, and if there's a need for them to be isolated in centers such as hospitals, they may need to get admitted. But if they have mild symptoms, The recommendation is just for them to go into self-quarantine for 2 weeks or until their symptoms resolve. But it is very important that during this time that they are on self-quarantine or while admitted in the hospital, that their medications are adjusted according to the blood glucose levels that are monitored. And it is important that their blood glucose levels are monitored more frequently in order to adjust the dosages of their medications. For patients with diabetes who think that they may be infected, first and foremost that they need to ask themselves is, do they have any exposure? Because we all know that you will only get this viral infection if you get exposed to someone with the infection himself. And so if there is no exposure to someone who has fever, cough, or even shortness of breath, then the likelihood is actually low. But if you do have exposure, if you have recent travel, or even if you are working in a very high-risk environment, such as a hospital, it is important that when you do suspect yourself as having this particular infection, the COVID-19, number one, you have to seek consult with health authorities, and there might be a need for you to get tested for this particular viral infection. In the meantime, that you're waiting for the results of the test, it is important that you isolate yourself or at least you separate yourself from other individuals who are not infected or who are currently asymptomatic and even healthy. The most effective strategies to prevent COVID-19 among our patients with diabetes would still be, of course, social distancing, as has been recommended globally. Of course, we all know that since the major way of transmission of this disease is via droplet infection, then of course, having a physical distance away from another person who is coughing or sneezing or has an infection would be a very important preventive measure among our patients with type 2 diabetes. Very important as well is frequent hand washing, because we all know that the virus can stay on surfaces, and if we hold on to other surfaces and the virus gets attached to our hands, and if we, of course, wipe our faces or even our nose with or touch our noses with the hands, we know that we can easily get infected by this particular virus. So hand washing, social distancing are very effective means of preventing COVID-19, not just among our patients with diabetes, but for the general population as well. I'm very happy to note that the Philippine Society of Endocrinology, Diabetes and Metabolism came out with its position statement on COVID-19 among patients with diabetes. And this particular position statement is highlighted by three very important topics. Those for patients to prevent COVID-19. Number two, for the treatment of COVID-19 among those patients with diabetes. And very important, an advice or recommendation for the healthcare workers. And it is important that we take into consideration not just the preventive aspect, but also the treatment of COVID-19 among patients with diabetes. And of course, very important, healthcare workers must also know the proper way, not just to take care of the patients, but to take care of themselves as well during this COVID-19 crisis.